say how we're going to do it this afternoon is I will take the lead initially and talk a little bit about some of the challenges young people face globally. So just to give you an indication of what young people are up against. And then we're also going to talk about some of the people, places and populations involved in resilience research. And then we're going to talk about resilience as a process, in terms of how our understanding of resilience has shifted over time. Because the resilience concept, but also resilience as a process has changed enormously over time. I just have to remember to do the slides.
Well, I was going to do it, but we're trying to work out how we're going to arrange this because the equipment isn't in the right place. You still want me to? I can stand and do your report.
Okay.
Thank you. Get enough.
Thank you. So, if you could move it on, okay. So, international research and policy interests in resilience has increased enormously during the last decade. And resilience is now considered to be a valued asset or resource with which to promote health and well-being, and forms part of a broader trend towards strengths-based as opposed to deficit-based models of health and illness. So there's a shift in health policy and research away from problem-based or deficit-centered models, focusing more on well-being and appreciative approaches to health. So there is a developing critique of resilience, conceptual limits and normative assumptions. So dominant associations with normative development, meeting certain developmental markers, and associations with psychopathology when young people do not meet these markers. So during the presentation we will present how narratives of resilience have shifted over time by examining two established narratives of resilience. Firstly, resilience is found within people, and then resilience is made, which is resilience kind of as a process socially constructed between people. And then the third narrative is resilience as unfinished, which kind of draws on post-structural understandings of resilience. So, absolute poverty is defined as living on the equivalent of $2 a day or less. And this is money that people have as expendable capital and cover the basics as food, shelter and water. So medicines and new clothing and school books would not be on a priority list when people would live with that little funding per day. And the map is a useful portrayal of young people living in absolute poverty. So when almost an entire population lives on less than $2 a day, it is unsurprising if undernourishment is high, education levels are low, and life expectancy short. So in places like Nigeria, which is Central West Africa, and Mali, which is Northwest Africa, 9 out of every 10 people survive on less than $2 a day. And Southern Asia, places like India, Bangladesh, Pakistan are not far behind. So if you look at the map, it's the areas that are expanded or indicate as larger than the others. And in Southern America or South America, 39 million people in Brazil live on less than $2 a day. So there are a great number of people living in absolute poverty, which has an impact on young people. And then the next slide shows that 435 million children and young people are underweight globally. And there are no territories without some underweight children and young people living there. And the percentage of underweight children can be as low as 1% in places like Japan and Chile, and the highest levels of underweight children and young people live in Southern Asia, with almost half of all children under 5 in Bangladesh, Nepal and India are underweight. Other areas with high numbers of underweight children are Ethiopia, which is kind of North East Africa and Indonesia, and also Nigeria and China. And then illiteracy in young women. Globally, there are 251 million young women, and this map shows the number of young women that would need to be educated to reach the same literacy rates as young men in each territory. And the biggest gaps between male and female literacy are in Northern Africa, in Southeastern Africa and Southern Asia, where 24% of women aged 15 to 24 cannot read or write. In Pakistan, the highest levels of female literacy in the Middle East is in Yemen, and in Eastern Europe it's Turkey, and in Asia Pacific, Indonesia. And access to education has implications for young women's ability to gain an income, their nutritional status, and also the ability to maintain health and well-being. And then if you look at the global health spending, most of public health spending occurs in the global north, with very limited public health spending in the global south, and particularly in the countries that we've just identified with problems with low expendable capital, illiteracy, and also poverty. So the greatest needs are in parts of South America, Central and West Africa, Southern Asia and China, but they have the lowest health spending per person, which has implications for the health of young people. And then if we shift on to start talking about some of the early resilience research, Garmese used epidemiology to study who gets ill and who doesn't and why, to uncover the risk and protective factors that now help define resilience. Resilience emerged as a major theoretical focus area from the studies of children of mothers diagnosed with schizophrenia in the 1980s. And results showed that children of a parent diagnosed with schizophrenia may not obtain comforting caregiving compared to children of healthy parents. And such situations had an impact on children's development. Some children of these parents thrived in meeting their developmental tasks and were high achievers, which led researchers to make efforts to understand resilient responses to adversity. So researchers were really interested in why some children were able to flourish irrespective of growing up in circumstances of extreme adversity. And that's how resilient research started. So resilience research shifted the focus away from youth pathologies and risk factors associated with pathology to analyzing how and why high-risk young people develop instead into competent, confident and caring young adults. So competence is assessed by how well the child is meeting cultural and social expectations for children as they grow up. So Werner and Unger raised the issues of cultural specificity, where developmental theories based on Western urban studies incorporating culturally dominant, usually white middle-class notions of childhood, child rearing, education, life stages and values. So for example, if we look at the two images, developmental tasks for a 9-year-old child in Johannesburg, South Africa, might have less to do with educational achievement and more to do with surviving on the streets or finding a safe place to sleep and securing their next meal. So resilience research really has to take account of the cultural specificity and also the impact of social relations and environment. So as a result of that, people started undertaking international resilience studies where they found that risk is contextually specific. So risk and protective factors associated with resilience are based in specific conditions, cultural values and norms. So what constitutes risk in one context may not apply to another, or elsewhere may constitute a protective factor. So the image in the background is of young boys playing on an old burnt out army tank in Afghanistan, and exposure to weapons of war and the effects of international conflict has become a part of daily life for these young people. So an understanding of the weapons and how they operate, and inclusion in informal social networks or gangs are seen as a protective factor by these young people. So resilience acknowledges the cultural and social interplay of individuals in relationships and environments, their families, their neighborhoods, and their schools. So Michael Unger and Liebenberg is currently undertaking a range of international resilience studies, and they aim to develop a better, more culturally informed understanding of how youth around the world effectively cope with adversities they face. And the International Resilience Project uses cross-cultural approaches to examine individual, interpersonal, family, community and cultural factors associated with building resilience in youth around the world. And they examine the culturally and contextually varied ways resilience is understood, as well as constructive outcomes achieved by children faced with adversity, such as poverty, war, violence, drugs, the illness of a parent, family or community dislocation, and cultural disintegration. And the study takes place across 5 different continents and include 1,400 children in 11 different countries. And Unger defines resilience as a social ecological concept more than an individual capacity to cope. Though personal agency is crucial to child development in adverse circumstances, the provision of a well-coordinated service delivery system that prevents exposure to risk, promotes the development of a child's strengths, and addresses psychological disorder and social disadvantage is far more likely to account for positive developmental gains than individual factors alone. So in other words, an ecological perspective of resilience suggests for children with very complex needs, living in adverse environments with multiple biopsychosocial barriers to growth, social service systems design, and also the policies within which these systems are situated are crucial to the processes associated with resilience. And then drawing on a study of the experiences of young people from an inner city public housing estate in Sydney, resilience is young people engaging in processes that accrue positive outcomes, not only normatively defined as meeting developmental goals, but in the context of adversity, resilience may include resistance. So young people's participation in activities such as substance misuse or truancy and crime, detachment from families, and participation in street culture, defined normatively as disordered behavior or delinquency, are from young people's perspectives the activities, places, and relationships in which they find well-being and belonging and power. So young people were stereotyped at school based on the areas in which they lived, and by the young people getting together in social groups, establishing kind of social networks or gangs, they found a sense of belonging and companionship, and also it acted as a space in which they could challenge or question discourses that might have been marginalizing of them. So through rejecting discourses which might have portrayed them as not good enough, or perhaps not being able to amount to anything because of where they are coming from. So resilience can also in some contexts be seen as a form of resistance. So the study placed resilience work in the larger social and cultural context, suggesting that interventions for resilience building need to recognize the embeddedness of resilience in social inequalities. So we have to take account of the social inequalities that impact on the lives of people and the adversities that they face when we do resilience work. And then resilient practice research based in the UK, and Kim Arman is here this afternoon, so hopefully she will be able to help us unpack some of these ideas later when we do the discussion. So this research is undertaken at the University of Brighton by Angie Hart and other people, and Kim, where they undertake research to try and develop, in collaboration with young people, resilient practices. So poverty, stigma and social exclusion leave vulnerable young people exposed to emotional and mental health problems. And research into health inequalities frequently exclude the most disadvantaged, and few studies involve young people in developing interventions to promote their own mental health and well-being. So resilient practice research conducted here in the UK by Angie Hart and others involve young people and practitioners to develop interventions to promote and sustain resilience as a way to promote mental health. So resilience practice builds on the coping strategies and abilities of young people and their families that they already have. And it's based on respect for plural knowledge and experience. So it acknowledges that there is value in the locally held knowledge of young people and their families, and we kind of work with that knowledge. And the research is delivered by a group called Communities of Practice, where practitioners and families and young children work together to develop these forms of resilient practice. And I'm going to hand over to Kay to tell you more about
this
evaluation.
I worked with Kim, with Angie. I came to resilience work through Common in our research centre, and I have to be honest, I didn't have an interest in resilience when I first started. And my background is social sciences, so I came to it and with particular ways of looking at the world, and especially those post-structural sort of deconstructive ways. So I started from that sort of premise in a world that felt much more pragmatic than that. So it felt a little bit like I was an interloper in some ways. But Kim and Angie have been very busy working with parents, with foster carers, with practitioners and with academics to use a communities of practice mechanism to, as Laetitia was suggesting, bring together different sets of knowledge around resilience and then how you can promote that when working with young people or children. And I was involved in a one-year COP programme funded by East Sussex Local Health Authority and Council, which was delivered to practitioners in these services, both statutory and third sector, and, as I said, foster carers. The resilient therapy was a framework that Angie and others had devised that took the best of the evidence base around resilience and put that into a systematic approach to thinking through and then delivering resilient practices or therapy. It didn't originally have this term, therapy, but I believe that's changed much more to a practice, and that sort of, I guess theoretically as well, that sort of introduces interesting ideas about how to do resilience as well. And I did a small evaluation. It was sitting in with Kim, watching her facilitate that programme for a year, and once a month for 3 hours, which practitioners, if you've ever worked with practitioners in health and social care settings, really value the time out from practice, from the front line of day-to-day work and pressures, to have a space where they could come to learn something. And the other very novel thing about that was to have a space where they had a considerable length of time to learn about that practice, which again is something that many other training programs that they've had or been asked to undertake do not have that feature. They're very short, intensive programs of like 1 to 2 days or 5 days at the most. From that, and we did a bit of observational work of that, and I did follow-up interviews, about 13, 14 follow-up interviews with practitioners, and that was post their experience of the course. It would have been nice to go back sort of 6 months later after that to see how they're feeling now in practice, but the time at which I interviewed them they were in a state of service change. We just had the coalition government elected, and there were all the notices and announcements about cuts to public sector services. And their security of their jobs, their posts, their ability to take this practice and do anything meaningful with it was severely jeopardised. And I mention that because one of the aims of the project was not just to look at how they might work with people as one-to-one, individually as practitioners or with families, but it was also to think about them as a workforce that we were building capacity in, that could go back into their services no matter where they were and cascade out these sorts of practices. So it was thinking more systemically about how you create resilient organisations or workforces. And that really got quite threatened by the political changing landscape of public sector cuts. So that was quite sad, really. But what we found for most of them is that learning about resilience has, and this isn't a novel finding by any means, but it has an impact on themselves and their understanding of resilience and their own sort of appreciation of their resilience. I mean, I came up with sort of like themes from that research that talked about the increased responsiveness that they had, the increased reflexivity they had about their practice, and resourcefulness. The framework gave them a map, a way of feeling that they had a strategy to talk to people about resilience in a way that they felt previously they might have been a little bit sort of out of their depth or not sure what to do with people that were coming forward with, continual difficulties or severe disadvantage and adversity, and not feeling that they had the resources to be able to help them. This gave them a roadmap of where to go next and try something else that was grounded in the evidence. But the other thing, I guess, about that was also that in learning how to be resilient themselves, it then left them very frustrated that they actually couldn't take what they'd learned in the programme and then implement that fully in practice, not just because of the organisational changes that were going on with cuts, but also because of the way systems are set up. So most of their work is short-term intervention work, where most of what the resilience research tells us is it's based on relationships. And to sustain relationships over time, you have to build trust. And if you haven't got that in statutory services or third sector services, then you're really working up against a barrier or constraint that almost feels impossible to overcome. I think that's, I guess, if you want to ask a little bit more about that. So why did we go to, I have to switch glasses, get to that point where one pair won't do anymore. I guess coming to talk to you today, I haven't got a global health background, I should state that from the outset really, and I've talked to Laetitia about this. My interest in narratives was working with Angie and Kim and and working with them to try and understand what this concept was. And I was very aware that there were lots of critiques around resilience with the notion that actually it is nothing, actually it's just a word that's very in vogue at the moment. And as Kim and I have said, it's going to have a fashion moment and then it's going to peak and disappear possibly. But it's in all the policy documents, and so I came to it with working with Angie, looking at policy documents that were talking about building capacity, building resilience, working with assets, strength-based ways of working, solution-focused ways of working. My background's community nursing, and you may know this, but health visitors and nursing in the community is expanding enormously at the moment. It's the one area of the NHS that is, growing. And the aim is to build capacity. It's all come from Marmot and his, argument that early intervention work is the best way to address social inequalities that lead to health inequalities. So I've got this very UK-focused sort of nature to my work, I must admit. But the other strand to that was that, as I said, my background's in social sciences and feminist ways of working and post-structural ways of looking at the world, and an interest in working with Laetitia when we looked at narratives and identity and the body, that we began to look at some of this resilience work and realised there was no discussion actually of the type of subject or notions of resilient identities or any discussion about resilient bodies. Like if you go to Sociology of Health and Illnesses, I'm sure you might know this, concepts of embodiment and the relevance and the importance of the body to our understandings of health and well-being have been around for a long, long time. So it felt like there was this enormous gap, or maybe not, I don't know. And so we started to sort of try and work out, well, if we had to sort of think about this landscape of resilience work, how would you move on to think about post-structural understandings of resilience? And so I sort of come up with quite a clunky notion of 3 types of narratives, and part of that was just really to simplify what we were looking at, and it's not to do an injustice to the complexity of positions, because certainly many positions are not purist. You know, they're drawing on different strands of different theories, there are different mix of philosophies, they want to do very practical things, like I'm thinking in particular of resilient practice. So it might be drawing on sort of attachment theory, which might be wedded to modernist understandings of psychology and the psychological subject. But it also is drawing on critical social theory or critical realism, but it wants to be very pragmatic in the way that it carries out its intervention, so it's ready to work with and adapt to the context in which it finds itself. So I am very aware that in our paper we've created these three stories, and they can look a bit like caricatures. In fact, that was some of the feedback we got from the reviewers, was that these are a bit sort of stereotypical. But they were helpful, and in other presentations that we've done on this work, they helped other people see that these are the broad outlines and contours. So drawing on Richard Rorty and pragmatism, and I only know a tiny bit about Richard Rorty and pragmatism, but he talks about all knowledge as either found or made. You know, it's the classic sort of division between realist and relativist ways of knowing, between positivism and sort of constructionist ways of knowing. And so we used this notion of resilience as found, which was to depict that psychological initial sort of generation of research that tried to look inside people as having some special innate attributes that were unique to them in order to understand how you might spread that to others, to the notion that resilience is ordinary everyday magic, as it's called, that it actually exists in all of us, but we can still find factors or capacities or attributes inside us that we might want to foster or encourage or support. And this notion of resilience is unfinished, and that was really just to tap into, well, if we were going to use, and they are mainly feminist post-structural theories, and did we need to use those, I guess is another question. What would we be saying about identity, the body, subjectivity, or more importantly, the notion of the subject that underpins all of these stories of resilience? And would it give us anything else that we could say usefully about resilience? And in fact, would it do away with resilience, the concept? So we were quite interested. We weren't sort of wedded to the idea that this was going to open up a fantastic field of research necessarily, which might sound I don't know. But I was very interested just in this notion that if we did this, what would we see? What would we find? Would it give us extra theoretical resources or tools? And the other sort of impetus for that was that we found, just in some of the research that Laetitia's already mentioned, sorry, I'm going off script here, I know, sorry, just in some of the other research that Laetitia's mentioned already, especially the Bottrell and Mumford and Sanders paper about the young girls in New Zealand, was that they were already, and Unga's already using sort of social constructionist, stronger version of social constructionism. He's using Foucault. He wants to draw on those notions of fluidity and identity. And they, in their work with young girls, were picking up on the notion of identity and how important that was. And it all began to fall away a little bit from resilience and began to make us think, well, actually, maybe there's something more fundamental here about, broader concepts of health and well-being. And even those concepts are sort of pretty loaded at the moment because of the way they're appearing in UK policy documents. I was just going to go just a little bit say about undoing as well. Sorry, Laetitia, I'm back in your mouth. So the unfinished taps into that post-structural set of things. And Judith Butler's notion of undoing is what we're referring to in the title there. It's just really to, again, alert us to the sort of the focus of this work in story 3, which is to deconstruct, but not just to do away with and to critique it. I've been reading some really interesting things there about how that sort of strand of social science knowledge can leave us very sort of paralysed and impotent in some ways, because we just keep doing away with things and not really suggesting what else can come in its place. Someone calls it paranoia. Just this idea that there's always something to trip you up along the way. But drawing on a notion that once you undo something or you deconstruct it, you should also be trying to reinscribe it, to reuse it, to rethink it, to reimagine it. And I guess that was sort of also our starting place for this. So taking story 1 then as this idea that, as again, Laetitia's already mentioned this, Uncas already had worked this out, that there is a classical position with resilience work. It's the very early work. It's the work that is wedded to a notion of either biomedical or psychological models of resilience. usually associated with child development as well. So there is this chronological, temporal dimension to it. You acquire it in early years, and I guess neuroscience has added that impetus to it as well. That if you don't get it in that window of opportunity, you may have lost it for good, which has huge implications, obviously, for work with other age groups. But once you start to look at that, you also see it's a little bit more complicated than that. So there was this trend from exceptional to everyone's got resilience, but it still tended to be described as if it lay within the person, within their personalities, within their sort of innate attributes and characteristics. But there was also a strand of work, Rutter and others, Luther, they've also tapped into this idea that you can have these innate capacities and abilities, but it is also associated with factors that can also be externally located, so they can threaten your own internal capacities and attributes. So we talked about this as story one, as having story of resilience as found, so it was something found within inside us, which again, as I say, really simplifies what are very complex positions, because there was still some attention to assets and support systems. So to undo story one, this was really to look to see what type of subject lay at the bottom of all of this work. And as I've already alluded to, actually, this is the story of an individual identity or subjectivity and a sense of self that's really conceived as something belonging to an individual. You know, when you describe yourself, it's I have a personality. I don't do my personality, I have it. It's something that belongs to you. And that alludes to the sort of very modern understanding of the subject and the individual. And we know probably that throughout the sort of 20th century, the rise of individualism has dominated a lot of discussions and debates around health and welfare. So this is somebody possessing innate or essentialist attributes, relatively stable, coherent, developing chronologically. The focus on those innate attributes, we felt, left this subject as quite disembodied, because like I say, there was no acknowledgement of how that resilience was being expressed or manifested through bodies at all, or any appreciation that this was a body. It was very much the mind, which is why we referred to psychology a lot. And in the literature, if you go to look at this construction of the psychological norm that underpins a lot of welfare work, which has been critiqued previously, in setting up this notion that you have this normal self, and this normal self gets equated with being a resilient self, it has implications for those of us that don't want to be resilient or can't be resilient. And they get positioned, as some of the other work showed earlier on, as deficient or lacking in something. And then that justifies us as experts, as practitioners, to come in and say, we know how to make you resilient, possibly. There's some really interesting work coming out of this university, actually, looking at resilience in that way, that critiques it very much as setting up this normative understanding of what a resilient subject is. And by doing that, you are measuring, obviously, everything else that is different or not from that. Did you want to talk to that, or shall I carry on? Yeah. So just on that, I mean, again, Uncas is the person that really started off that critique of story one, story found, resilience found, the classical position. And he draws on social constructionist understanding, as I said, he's drawing on Foucault's notion of power and knowledge and discourse. And his argument, he starts off by saying, because this constructionist notion of resilience is not something that we have, but something that we do. It's culturally and socially produced. It occurs in a space between people, as Laetitia's already said. It's active, it's practice, which is why it ties in nicely now with resilient practice as well. He was also one of the first to point out that normative base to resilience, and that what gets defined as a risk factor is open to contestation. If we take that lens, obviously if you choose to look at the story of resilience this way, you start looking at it differently. Not dissimilar actually from sociology of deviance, really. You know, you start off by saying, oh, actually, who's defining deviance or difference here? Who gets to do that? And so that did open up, I feel, when we look at some of the research, quite a field of critical work now that's going on looking at resilience. As we said, some of those papers we've just picked out, they're not the only ones. But the emphasis here, and certainly in his international research project, is that resilience becomes something you do that's iterative. It's a communication between you, the subject, your community, your family, and the systems or the environments that you find yourself in. So it makes the concept or the processes of resilience much more complicated. And because he's working across all those countries, and I've forgotten how many they are now, but he has had to work hard to appreciate that he might be coming with very normative understandings of resilience, very Western, very white, very male, very Eurocentric notions of resilience, to appreciate others' bottom-up sort of approaches and understandings and definitions of that. And not in obvious, literal ways either, just trying to map out what might manifest in behaviour, mostly, as resilience. And I say that with some emphasis because that's some of what social constructionist does still have, this emphasis on giving an emphasis to meaning through looking at behaviours, which is what post-structural and psychoanalytical sort of inflections wouldn't do. But having said that, even with, and we all are very appreciative, I think, of Uncas' work. He's done masses. His website, you could spend hours looking at for the amount of work that he's done on resilience. And certainly Angie organised a international resilience conference last year. Was it last year, Kim? Yeah, and he came and spoke, and he was, spellbinding to listen to, because he's got fingers in every country virtually looking at resilience to say something meaningful. But what's really interesting is the way that he's trying to draw on very complex theories that sound very abstract to the everyday work of resilient practice and the everyday work of those that are trying to support people in disadvantage or adverse circumstances. So it felt like we were sort of capturing a bit of a moment that we were joining him on to try and say, well, actually, if we push this a little bit, where does this go? And it's not always that successful, I must admit. But I'm doing story too. So we tried to, even though we were sort of on board with Uncas, he's got great ideas, we were all up there and agreeing with most of what he was saying, weren't we? We still felt that you could offer a critique of story too. And so, although this offers us a very critical perspective, we still felt that it never really examines or only alludes to the concept of the subject. Maybe that's not the nature of his work in some papers, but in other papers he tries to start to begin to do this. There's no exploration even in these theories which would allude to sort of more stronger versions of social constructionism. When you're working at that end of social constructionism, you're really working with postmodern understandings of the subject as decentered, fluid, fragmented, which makes for very tricky conversations sometimes. But this idea that that is the nature of the subject in that postmodern theorising, which I know many people have critiqued. But even with those theories, that we never actually give an account of how does that happen, how does that get sustained, and how meaningful is that, and is that really useful to us if at the end of the day we want to do something politically, practically, to improve or progress anything. We drew on Gergen, actually, to look at relational ontology, because he's come up with this notion of relationality and this still constant divide, even in social construction theory, between the subject, the self, and the outside world, between agency and structure, between culture and nature, that we retain these binaries sometimes, even with this type of theorising that attempts to sort of do away with some of that. We still hold on to it, sometimes hidden as well, not always made explicit, and we're all a bit guilty of that. And then I guess there's also a little bit of a tendency to leave what are sometimes called foundational categories, of which the subject would be one, identity would be another, the body would be another, untouched. If we just keep looking at the expression of resilience through behaviour, even when we're using social constructionist theories, we can tend to leave that untouched. And one of those would be experience. That's a very troubling concept in research now. To go out and do research and to capture people's experience is considered to be very, is much more complicated. The whole process of how we reconstruct experience in a research setting and giving voice is not straightforward anymore. So, and just drawing very briefly just at the bottom there on what I began to see in some of the literature, and some of you might know Stephen Frosch's work around trying to, the way social sciences and humanities are reappropriating psychoanalytical theory for their own purposes and their own ends, to try to give us a more sophisticated language to describe subjectivity and some of the unspoken and unthinkable or unspeakable aspects of life. And I began to think, well, maybe that's true of resilience. Maybe we keep assuming resilience is a good thing to promote, and maybe, like I said earlier at the beginning, maybe we want to feel our pain and suffer, and maybe to not be resilient is quite an oppositional position, but we can't say that out loud, or we can't think that. So unfinished, Stephen Frosch's work on the psychosocial subject. We've got Paul Stenner and David Taylor over at Brighton that have worked quite a lot on this in terms of welfare states and welfare subjects, and about bringing together, trying to overcome this divide between agency and structure, the individual and society. That's really what the psychosocial subject is trying to do. It's trying to suture together how much agency we have and how we're constrained by structure, but without trying to just add things in, you know, not having a sort of psychosocial, biological, environmental person at the end of it. But these theories alerted us to the fact that the resilient self might be a self in process. Again, if you're familiar with these ideas, these won't be new ideas to you. There's been quite a lot written now about the processual subject that draws on notions that ourselves, our construction of ourselves, we perform every day. It's not something that's coming from inside us. Again, it's something we're doing, but it has to be repeated all the time. So to have a gendered identity as something that gets repeated or recited, daily practices. And then, because we're both very much wedded to post-structural feminism, this idea of recognition and ethical violence and embodied subjectivity, those were the sorts of ideas we were going to draw on to look at story 3. And in the paper, we've talked about turning into this deconstructive work, because we're very aware that it does leave research in a very uncertain position. But it does have its roots and can be compatible with critical theory that would want to implement change. But it does draw on notions of the self as a subjectivity that's negotiated, embodied. It pays attention to the affective, so there's an emotional content to this. It's relationally and historically and culturally situated. And that's not just relational in terms of my relationships to others, it's about relationships to places, material artefacts, times, memories, events. So it does start to broaden out our understanding of resilience. And just interesting, a paper, just a very recent paper on ageing and resilience, repeats that actually, this notion that memories might be resilient. So this notion that a concept of resilience might expand and become something more than in ways that we may not have thought of previously, may begin to make this feel a little bit more relevant. So what we've looked in this paper, we've expanded story theory to identities, resilient bodies, and resilience and recognition. So just these next 3 slides are just doing that in a little bit more detail. I won't spend too much time because I'm very aware of the time moving on. If you're in, some of you will know Judith Butler's work. She's quite prolific and has written lots, and her very early work was quite controversial because it seemed to ignore the material world and bodies. Her later work still draws on notions of performativity, and we've drawn on that as well to look at recognition. So she's much more interested now in sort of notions of ethics and values and interests. But initially that's given us a way to think through. If we use performativity, we then begin to think through a subject that is not stable. Their resilience becomes unfinished. It's in a process of remaking. And we've argued that that would open up, theoretically, the door to looking at resilience across the lifespan. We might elect to do that, but theoretically, if you use these sorts of notions, you've got a notion of the subject that is suggesting that this is the case and that this would allow us to look at this in a different way. But this would also be a subject that would identify and misidentify in complex ways with the demands to be resilience, which again, when we looked at the literature, we found children, teenagers as mothers, as workers, as gay or disabled. Uncas done a lot of collecting of empirical work that looks at all those different groups and their notions of resilience. And for us, that subject that underpins those accounts could be this one. It could be this performative subject. Yeah, and it possibly gives us, like as it says there, the subject of resilience is always becoming and the way to resist. But the other argument that we had was that in focusing in on the processes, you can start to look at the micro or the more mundane ways in which people generate resilience. A bit like where health inequalities work has gone in the UK. So, we might have the big macro picture of what creates health inequalities. But in order to understand the everyday experience of it, people have begun to look at what is it that happens every single day in people's lives, in their intimate lives, that generates or not inequality or equality. So it gives us a much more complicated picture. I don't know if any of you've looked at theories of recognition at all, but this is where a lot of Judith Butler's work's gone. Trying to understand how we recognise somebody else as a viable human being is essentially the work. It has powerful resonance actually for global health when I think about it, because she's looking across the globe and thinking about how is it that we treat or respond to others. How do we recognise them not as a threat, but as an equal? And she argues that to be recognised is to mean that you are socially viable. She also, it's not just her, it's Honneth, Axel Honneth, and Nancy Fraser. They're all using these ideas of recognition and redistribution, so there's still this emphasis on the material world. And Honneth has an argument that to be recognised, that happens in three spheres: the intimate sphere, where you grow up, which resonates with a lot of resilience work, the legal sphere, where you're legally recognised as a viable subject, and the social sphere, whereby your peers or society, you might be recognised as socially viable. But the worst ill effects of that are to be misrecognised. So we started to think about how we might use that to think about resilience, about what that might mean to be recognised as resilient or not misrecognised. And that led us into thinking about resilience as doing, being, acting and feeling resilient to capture that notion. There's a lot more to be said there, but I'll just... And then again, those of you that have got a background in sociology of health and illness certainly will recognise concepts of embodiment. They're not new, but it was trying to think about what would happen if we applied this concept to resilience work and empirical literature. So concepts of embodiment draw attention to the relationship between the physical body and subjectivity, and the irreducible, fusion between mind and body that sometimes our literature and our research doesn't suggest. And I guess what we were trying to do here was already work out some ways in which embodiment and that notion of self creates embodied practices. And if we think of resilience as a practice, then we cannot describe resilient practices as anything other than embodied. And the monstrous bodies are those unacceptable bodies. So we started to think about, a bit like the young girls in New Zealand, what was unacceptable about them. Was it just that they were young girls, being resistant and subversive and resistant to those labels? Is there something there that we could look at that tells us that unacceptable bodies create, sort of complications for us in terms of understanding how we control or manage those bodies? And I don't know if you've read Margaret Sheldrake's work around the monstrous body, but she talks, it's about ethical relationships and how really we should realise that there's a shared notion of vulnerability amongst all of us. So when we're all in need of support and we are all vulnerable, and it's that sharing that ontological uncertainty that would prevent us from imposing our normative understandings of resilience on others. So finally, it's there really. How useful? Not sure. Some people, we did try to in our paper suggest ways in which it opens up the research addenda. It's difficult though, because we know these ideas aren't, they're not commonly accepted in policy making circles, so you're never going to go to the Department of Health or any other international organisation and use or draw on these theories to suggest a way of working that takes us forward. It does threaten empirical research, that's been said a lot in papers. We also are very aware that these are very Western theories, come in with a particular perspective. Harrison is the author from the University of Sussex that's talking about resilience in a piece of work that she did in New Haven, very local, critical social policy. And she also alerts us to the fact that there may be costs to promoting people's resilience. We tend to treat resilience as if it's an endless pot or resource within people, and actually asking people to be resilient on top of any other disadvantage and adversity might have costs to it. And she does cite another author that's looked at working in international developing countries, poor countries, to cite that as the crisis after the crisis, which some of you may know, that it could be a danger rather than a good. And of course, a lot's been said about the inherent conservatism of the concept of resilience, that maybe we're asking people to not just survive and thrive and flourish, but we're asking them to adapt to rather than challenging adversity.